Hi.
Hi.
Heather Sheline, nurse practitioner that's gonna see you today. Can you tell me your name?
Nathan Sheeling.
Hi. So I had heard Dr. Miller retired and you were looking for new primary cares. What brought you in the office today? It looked like from your history it had been about a year, a little over a year since you'd been in for an appointment. I kind of reviewed some of your chart, but I still would like to ask you some questions about your medical history, if you don't mind. Is that okay?
Yep, that's
Okay.
fine.
I mean, I'll try to make it a quick visit, like maybe 15 minutes or so, and if there's some things that come up, it's fine if we extend beyond that time. Just kind of wanted to get kind of the most recent history. Anything right now going on? Anything,
No.
any illness or injuries or nothing pertinent right now?
No.
No. Okay, so then we'll just go through your history, okay?
Yep.
So no current anything going on right now. Past medical history, any surgeries?
No surgeries.
No surgeries?
No.
Any hospitalizations?
No.
Nope. Any history of mental illness or anything? Nope. Okay.
No.
Any medications you take?
Lisinopril.
Lisinopril, so you have some hypertension?
High blood pressure.
High blood pressure? Okay. And immunizations, are you up to date on immunizations?
Yeah.
Had all your childhood vaccines?
Yes.
Do you have the flu vaccine annually?
No.
No. How about any COVID vaccines?
No.
No. And really, you are 46, so not quite of age for like the shingles or any type of vaccines like that, but Pneumovax, and there's some other ones that you could get in the future, but we'll let you know when you're due for those. Any family medical history? Anything pertinent with your mom, dad, hypertension, heart attacks, diabetes,
Just
cancer?
hypertension and some diabetes that I know of.
In your mom and dad?
My dad.
Dad is hypertension?
Yeah.
And who had diabetes?
My grandpa on my mom's side.
Grandfather? Okay. Was that type 2 diabetes?
I don't know.
I'm not sure? Okay. Any medical history with siblings?
No.
No? Pretty healthy? You
Yeah.
said grandparents? Okay. What is your relationship status? Are you married or
Married,
single?
yeah.
Married. Any children?
2.
2. And how old are they?
20 and 16.
Oh, that's good ages. Yeah. Any tobacco or alcohol use?
No.
No? No alcohol use at all?
No, just moderately here and there.
Okay. Like how often? Or
Just
at
weekends or
70s?
out on occasions or whatever.
Okay. And how many beers or drinks do you have when you do drink? At most?
2 or 3.
2 or 3? Okay. And you said no tobacco use, never? You've not?
Nope.
No? Okay. Any diet restrictions?
Nope.
Nope. And what type of physical activity? Do you do anything routinely, weekly, daily?
I work like a swing shift and I'm constantly outside, so.
Okay. So just normal activities?
Correct.
Daily life, not any, go to the gym or any running or anything like that? Okay. You feel like you're in pretty good health, or how do you feel? How would you rate your health overall?
I feel like I'm a 7 or 8.
Yeah, it's pretty good. Do you follow any specific diet or watch your calorie intake or anything?
No.
No? Okay. Have you had a pretty consistent, your weight has been consistent, or any loss or gain in the last 6 months?
I've lost like 20 pounds just by cutting out some sugars and stuff.
Oh, that's good. Did Dr. Miller tell you, did he have any concerns about like pre-diabetes or?
Yeah, he said I was leaning more towards that, so.
Okay. And did some blood work?
Yeah.
Okay. We might repeat that since it's been at least 1.5 years since you've had that blood work done, so we might repeat that. How would you, work attendance? Any illness that causes you to miss work, or
No.
how frequently would you say that you're sick in a year with colds or stomach virus?
Maybe once or twice for a couple days.
And it's usually over in a few days.
Yeah.
Doesn't linger or last
No.
a long time.
No.
Okay. Any issues with your sinuses, your vision, throat?
I don't think so, no.
No. You don't wear glasses or contacts?
No.
No. Ever any ear drainage or congestion, plugged ears?
No.
No. And throat, tonsils, everything feels normal back there?
Feels normal.
Okay. Okay. Any pulmonary issues, breathing, lung, any history of asthma?
Nothing on me, no.
With your daily work, you said you work outside. What type of work is that?
It's refinery work.
Okay. So some substances in the air, maybe breathing in some things.
Dust and it could be some other stuff in the air, but
Okay. Do you wear a mask or anything?
when it's bad out, yeah.
Sometimes. Okay.
When we
When you're
have
doing
to.
certain jobs.
We have to, right?
Okay. Okay. So ears okay, throat, lymph nodes. Sounds like pretty healthy overall. Any cough, lingering cough, or anything like that?
Nope.
No. Any history of any cardiac issues?
Nope.
Nope. Have you ever had an EKG?
No.
They kind of hook you up to the leads and check your heart activity, electrical? No.
Nope.
Might be a good idea to get one baseline. Just you're 46. It's probably a good thing to just see where you're at there. You said not really any, just the hypertension, but otherwise no cardiac history in your family, no strokes or heart attacks or anything.
Nope.
Do you have any numbness or tingling in your hands or feet ever?
I do not. No.
No? Okay. And your blood pressure, have you checked it recently?
Like the last time it was like 130s over 80 or 90, somewhere there.
Okay. And you take your lisinopril daily,
Daily.
as it's directed?
Yep.
Okay. Do you know what your dose is?
It's 5 milligrams.
Okay. Okay. Ever any history stomach issues, frequent diarrhea, constipation?
Nope.
Nope. Any vomiting? Just with a stomach issue once in a while, stomach bug kind of thing. Any hemorrhoids?
None.
Nope. Have you ever had a colonoscopy?
Nope.
Nope. Ever notice any dark or tarry stools?
Nope.
No. Okay. That would indicate a GI bleed. That's why I ask that. Any urinary issues, trouble urinating, or
None.
no history of kidney stones?
Nope.
No. Okay. Do you feel like you go to the bathroom more frequently than normal, or pretty?
No.
No.
Pretty.
Okay. Okay. Any rashes, skin issues? You feel like your hair growth is normal? I mean, from what I see, you look normal, symmetrical. Any issues?
No.
No? Okay. Any strange moles?
None that I know of.
No. And you work outside? Do you wear sunblock sometimes?
I always have to wear long sleeves, so.
You're covered there.
Covered up,
Okay.
yeah.
Might be good to wear a little bit on your face on the particularly sunny days when the UV's high. Any muscle issues? Any back strain or history of broken bones?
Never broken a bone, so.
Never broken a bone. Okay. Okay. And no back strain or injuries? Nope.
No.
Okay. Any joint pain when you wake up in the morning or late at the end of the day?
No.
Okay. And urology, any history of sexually transmitted diseases or no?
No.
Any trouble with sexual health? Nope.
No.
You do self-testicular exams? How frequently?
Like once a month or so.
Okay. Okay. Any memory issues, neurological memory issues, or
No.
numbness, tingling anywhere? You said no. We asked that in another area. Any history of head injuries?
No.
No? Okay. Have you ever required any blood products?
Never.
Never. And you said no dark or tarry stools. Ever any other issues? Like notice any bleeding, like bruising or bleeding gums when you brush?
Nope.
No? Okay. What's your support system look like? You said you have your wife and kids.
just some work friends and
Work friends? Okay. Good relationships there at work?
yeah.
And your family?
Yeah.
Things are good? Okay. Ever any history of suicide or self-harm?
Nope.
No? And you feel safe with in your home? Like,
Yeah.
relationships good? Okay. How do you sleep? Sleep pretty good, or
Pretty good,
any
yeah.
issues?
No.
How many hours do you think you get a night?
Probably 5 or 6.
I'd probably work towards getting a little bit more sleep than 5 or 6. Maybe shoot for 7, 8 hours of sleep, at least on your weekends when you're off from work. I think that's about it for my questions. We went through them so fast because you're just so healthy. So it sounded like lisinopril you're on for blood pressure, hypertension. I'll renew that because you probably need a refill for that. Did you mention, do you take any over the counters or supplements?
Just I take a once a day supplement, and then
Like a multivitamin?
yeah,
Okay.
and then just a Zyrtec when needed.
Zyrtec and a multivitamin. Okay. Is there anything you feel like we missed or didn't talk about that is concerning you, or
No.
no? Okay. Well, I'm real glad to meet you and have you come in today, and happy to help you if anything else comes up. I'm pretty available through my chart. You can message me through there or just call into the office. I think we'll order some blood work, maybe just some routine annual stuff, and I think that closes our visit up. So it was really good to meet you. Thank you.
Thanks.